the world, we've seen what happens when residents stay at home and maintain safe distancing versus when they do not. That is why we're reminding everyone that while it is acceptable to leave your homes to go on walks near your homes and to purchase food and other essentials, you have to stay at home as much as possible. You cannot go on long bike rides, walks, runs along the lakefront where you're going to be congregating with lots of other people. The same applies to neighborhood parks, and particularly playgrounds. The playgrounds under Governor Pritzker's order are shut down, folks. Please, you must abide by the order. Under no circumstances are you allowed to congregate. And do not let the warming weather let your guard slip, like today. Now, Superintendent Beck will speak on this in a moment, but not only will our police and public safety officers be deployed to shut down large gatherings, if we have to, because you are not educating yourself into compliance, and if you are not abiding by these very clear but necessary stay-at-home orders, we will be forced to shut down our parks and the entire lakefront if people continue to flout these social distancing guidelines. Now, let me be clear. That's the last thing that any of us want, and that's the last thing that I want to do as mayor. But make no mistake, if people don't take this in a serious way, in which they must, I'm not going to hesitate to pull every lever at my disposal to force compliance if necessary. But let's not get to that point. We don't need to. Stay at home. Only go out for essentials. If you want to exercise, do it in a way that you are not congregating with other people. And that means you've got to adjust your thinking about what your normal patterns and routines are. Of course. But be smart, please. There's no magic wand for the solution. And when it comes to getting through this crisis and getting our lives back to normal, each of us has a role to play. Never before in my lifetime has the conduct of others affected the actual health and well-being of so many. We are all in this together. It's not just a quaint expression. It has meaning and resonance like no other time in our life. Now, in recent days, we have taken bold measures to expand our capacity to care for those impacted by COVID, allowing them to recover safely and to prevent the spread to others. By the end of this week, we will have expanded capacity to over 2,600 hotel rooms across the city, helping relieve pressure from our health and hospital systems. And again, I want to thank every single hospital, every single CEO and the staff who have stepped up to help in this time of need. In that same spirit, I want to take this opportunity to call on Chicagoans, particularly those who have healthcare and medical training. We need you now more than ever. Please consider volunteering and other employment opportunities available on our website. That's chicago.gov/coronavirus. If you are a doctor or a nurse's aide, or somebody with healthcare training, maybe even a student who's at one of our community colleges or in one of our hospitals around the city, we need you. We need you to step up right now in this time. We've got to have additional resources and volunteers. These volunteer and employment opportunities, as I said, include nurses, certified medical assistants, healthcare administrators, and more. If you have training in any aspect of delivery of healthcare services, we need you. These personnel are critical to ensure that we have the healthcare resources needed to manage the surge of patients that we anticipate in the coming weeks. Please go to,
It's all right.
go here to chicago.gov/coronavirus, and we can set you up with training and help you staff one of the many different resources that we're bringing online. Now, also, we want to make sure that people are getting as informed as possible. You can do so at chicago.gov/coronavirus. And I've been deeply moved by the outreach and support that we've seen from so many people over these past few weeks. Just this morning, I was at the Greater Chicago Food Depository. There were probably 15 people of all stripes from all over our city who stepped up to volunteer to pack up boxes of food for residents that are in need. Now, whether from nonprofits providing critical food assistance to companies like Sitter City providing free childcare for our frontline workers, to our local hotels who have alleviated the strain on our hospitals by opening up space for individuals in isolation or quarantine, all of these actions matter and make a huge difference. But we need more help in order to succeed in our mission to bend the curve and break this crisis. Once again, those willing to volunteer, you can find opportunities online at chicago.gov/coronavirus. Finally, as always, I want to commend our incredible healthcare workers, first responders, and other city employees and essential businesses for their sacrifice and their work. We know that this is very difficult on you personally and your families, but we are grateful for you and the work that you're doing to keep this city strong in this very challenging time. These people have been our true heroes during this fight. Now, with that, I want to bring up our Public Health Commissioner, Dr. Allison Arwady, to provide updates and on the status of our public health response. Dr. Arwady.
Thank you, Mayor. So good afternoon, everyone. Those of you who have been following every day at 11 a.m., I've been doing Facebook Live, and we take questions from the public. We explain a little bit about our situation in Chicago. We talk about our Chicago data. If you haven't been following and you're in Chicago, go to the website. You'll find links, and please do tune in. We want questions. I spent this morning coming back to a theme that we've been talking about over and over again, which is this idea of flattening the curve or bending the curve. Why are we talking again so much right now about the need to do this? It's because we're seeing, not just in Italy, but in New York, in cities around the country, major stresses on our healthcare systems. As this virus spreads, we are worried about whether our healthcare system will be able to handle the influx of patients. I talked this morning about a social distancing scoreboard that has been put together by a company called Unicast. You can go and find it, unicast.com. They actually took anonymized cell phone data from across the whole U.S., no names attached, but they looked to see how much we move. And they scored the whole U.S. on how much are we all moving now compared to how much we were moving, a week ago or 2 weeks ago. And Illinois got an A on that because we were down as a state 40% from what we were moving even, a week and a half or 2 weeks ago. And 40% was the cutoff for an A. But I am not okay with 40%. I need Chicago at an A+, maybe an A+++. I showed this morning on my Facebook Live a little video that helps teach you about the difference of spread when 75% of the people are home versus nobody is home. It's a major difference in spread, and right now, for this virus, we don't have a vaccine. We don't have a treatment. We are prepared. I would give Chicago an A for preparedness. Honestly, I've never been so pleased that we've done all of the work we've done over the years to be as prepared as we can be. Our hospitals are stepping up every day, but we're planning for some real worst case scenarios. I want to be honest about that. And we do not want to wait until our ICUs are full. We do not want to wait until we're having to think about taking care of patients in settings where we don't want to take care of them. You've heard that we've stood up thousands of hotel rooms. We're looking at hospitals that have closed and how we can reuse them. We're even looking at some much bigger scale plans in case we were to really need to expand our healthcare system. But right now, these next few weeks, really the next 2 to 3 weeks especially, are the most important time to do everything we can to flatten that curve or bend that curve, because doing that is what helps keep our hospitals going. You heard the mayor ask for volunteers. I want to echo that. Thank you to everyone who already is part of our Medical Reserve Corps. You'll go to the website, you'll see information there. It takes you to a section called Illinois Helps, and that's where you put in your information and your background check gets done, your licensing gets done, and then Chicago is able to call on you as part of the Medical Reserve Corps. But I want to highlight that in the Medical Reserve Corps, we're actually interested in identifying folks who might not be the ones you're always thinking of. Certainly, if there are doctors or nurses who are not already working in the healthcare system and might be interested in volunteering, please sign up. But we're interested in students. We're interested in people who may have worked in other healthcare settings, and we're interested in people who may not have worked in a healthcare setting, but might be interested in volunteering in a setting where it's appropriate, with the right training, with the right personal protective equipment, because we may need more people to help step up. We don't need them today. I hope we won't need them, but we want to be ready in case we need personnel. So in the same way that we've been talking a lot about personal protective equipment, I want you to know that the Chicago Department of Public Health continues to use our supplies. We are sending masks to hospitals. We are sending gloves. We are keeping our first responders stocked. Again, we've done good preparedness in that space. But we want to keep everybody safe in Chicago. And where we're looking at our rise, in Chicago here, we are at 730 lab-confirmed cases of coronavirus. We've had 5 deaths. I've talked a lot about how this spreads and how it doesn't, what it's like and what it isn't. I want to just put one number in your head. I've been talking about the fact that one person with novel coronavirus, without the social distancing, in a population where nobody is immune, spreads to about between 2 and 3 other people. And I've been using that to help you understand that this is not like measles. This is not airborne, that everybody in the room is going to get it. But here's the problem. If one person spreads to 2 people, and that keeps happening, over and over and over and over again, we are doubling our outbreak. And so actually, as a city, what we're doing is working to move that number. I talk about this on the Facebook Live if you want to go back and see this. We're actually looking to move that number down from between the 2 to 3 that we see internationally. We need to move that down actually under 1. So we get to a point that somebody with coronavirus is spreading to an average of fewer than one person. That is actually how we bend the curve. We don't have a vaccine. It's going to be a long time until we have a vaccine. That's the best large-scale way to do this, but we don't have it. And so the thing that we have now that every one of you can do is to think really seriously about whether there are things that you can scale back even further. So certainly we don't want the folks who are still sort of going business as usual or playing basketball or having parties. I think that's pretty clear. But when I talk about us moving from a 40% down to a 75% down in our activities, the reason I say 75% is because we still have essential workers. We still need to make sure that we're getting food. We still need to make sure that we're getting the basics. But if you do not need to be out, I need you to stay home. If you are sick, even a little bit sick, we have an order here in Chicago, a law. I'll point you to the website and you can go and read about it. It highlights that even if you're starting to feel sick, you need to be home. And that's because we know one of the reasons that this coronavirus spreads to two to three other people. That may not sound like a lot, but it's about twice as many people as regular influenza can spread to. That's got more of a one person spreads to about 1.3 because we have vaccines. Right? Because we know more about how the disease spreads. And so when we're thinking about people very early in their illness, having a little bit of a cough, just not feeling well, having the potential to be spreading even at that point, again, it's a reason to stay home as much as we can. So I think with that, I will wrap up. Please do, if you've got questions or you want to see pictures about what I'm talking about, check out the Facebook Live. We're doing it every day. If you are interested in potentially volunteering in person in a quarantine or isolation facility, potentially in a medical setting, if you're interested not in volunteering in person, but you have special skills that where it might be helpful by telephone to be answering people's medical questions, if you have some expertise or you have some interest, we'd like you to sign up now. Get your background check done, we'll have you on the list, and we'll reach out further as needed. At the Chicago Department of Public Health, my folks have been stepping up in all kinds of ways. I have administrative assistants who are running entire sections of call banks. I have people who normally work on small things at the computer who are now leading large teams. Everybody's doing different things, and I need all of you to do different things too. If you can stay home, especially these next couple of weeks. We're hoping to see this curve bend. The actions we take today, we don't see for some time, but now is the time for those actions. And with that, I will bring up Superintendent Beck from the Chicago Police Department.
Good afternoon. And first, let me say it's an honor to work with Dr. Arwady and Mayor Lightfoot during a crisis. They are both crisis leaders, and it's a privilege. Second, to the people of Chicago, the public health orders that have been given by the governor, by the mayor, and by the Chicago Health Department are not advisory. They are a legal mandate. And violation of this legal mandate is a misdemeanor. It is a violation of the municipal code. If you violate it, you are subject to a citation, a fine of up to $500, and if you continue to violate it, you will be subject to physical arrest. Whenever a new order, new law, new direction is put in place, there's three phases. There's the educational phase, there's the warning phase, and then there's the enforcement phase. The educational phase of these public health orders is over. I called a meeting this morning with all of my chiefs and deputy chiefs. My direction to them was this: if people do not heed the warnings of our police department to not congregate, to stay at home if they at all possibly can, then we're going to start issuing citations. Not because we want to, but because we must. Because if we do not do this, Chicago is at risk. Your families are at risk. The seniors in this city are at risk. And this is something that your police department has to do. So beginning today, one warning. After that, you will be cited. Please do not make us do that. We take no joy in it. But we feel that it is absolutely necessary for the health of this city. So now I will bring up Superintendent Kelly, and he'll talk to you about the parks.
Thank you, Superintendent. So let me put an exclamation point on this message we're all delivering today, which is stay at home and keep your distance. Again, the governor issued an order for the state of Illinois, and in accordance with this order, all Chicago Park District field houses and all of our 580 playgrounds have been shut down. And while the green space is open and it's available, let's not all rush out at the same time to the same spots. Our parks are used as a brief respite. And I want to echo what the mayor has said, Dr. Arwady has said, and Superintendent Beck has said. The parks and open space are here for your enjoyment, but we cannot stress enough the importance of maintaining social distance. So again, if you're walking or you're running along the lakefront trail or in the neighborhood park, keep your distance, 6 feet or more. If someone's passing by, step off to the side, let them through. This is not a time for contact sports. No soccer, no basketball games. If you have to play basketball, play by yourself with your own ball. The public restrooms aren't open, the drinking fountains aren't open, and please, as best you can, even pick up after yourselves and take the trash home with you. Above all, if you're sick, stay home. Let's all work together and let's all keep the city safe. Thank you.
And let me just reemphasize a point that Superintendent Kelly just made, and I think he said it as precisely and accurately as can. Outside is for brief respite, not 5Ks like I've been seeing the lakefront look like in some of our parks. Brief respite, preferably in your neighborhood, briefly outside by yourself. But if you're with a spouse or a child, keep the social distancing going. Do not go to the same places that you normally go to congregate. Folks, I can't emphasize enough how important it is for all of us to abide by these rules. We have seen what happens in other places when that rule isn't abided by. We see the huge spike, not only in cases, strain on the healthcare system that is unbearable, and we've seen deaths. We don't need to have that here in Chicago. We all have the power in our own hands to bend this curve so that we all get out of it safely. So please, abide by the orders. Stay at home. Happy to take your questions.
Mayor, I have a bunch. Some of these are from me. Some are from Marianne Ahern and Dana Kozar, and then I know Kate is the poll reporter. Some of these are public safety questions. First, for Superintendent Beck, how long are you going to stay? Does your contract specify when you're supposed to leave? Also, the FOP on Monday raised concerns about roll call. Do you have any concerns about roll call? Are you going to continue to have those every night and day?
So I'll try to get all those at once. First of all, I will stay as long as Chicago needs me. I hope that in the last 4 months you have come to know that I care about this city, and I would never leave it in a time of crisis like this. You know, my family and I want my return to California to be soon, but obviously this is priority. So this is my profession. This is what I do. The FOP's concerns, many were well-founded. Many were things we were working on, and we have taken steps to create social distancing for our employees in a number of ways. One is we have directed the roll calls be discontinued in the way that they have been done in the past. We still need to give that vital information out, such as the information that's going to be put forward tonight about changing the warning process for violating the public health orders. So we will limit the sizes of those congregations to below 10. There's a number of ways you can do this, or we'll do it in areas that create a great opportunity for social distancing. So we're taking that into account. With the mayor's help, we've put up stanchions in our lobbies to keep the public 6 feet back to provide social distancing for both protection, for the protection of the public and the protection of the officers working the desk. And we have put signage at the front door indicating that people with non-emergency situations may be best served by calling 311, in which case they can get the service that they need over the phone and not risk face-to-face contact. Because again, you know, this is not just to protect the police officers in the station. This is to protect the public. You know, any way that any of us can find to limit social contact is good at this point. You know, the exact opposite of what we would normally talk about. And the third question was? Well,
let me ask you this. So what do you say to officers and supervisors who might be reluctant to send officers into large gatherings to break them up, obviously citing the health and civil rights concerns with going into those large groups? And also officers are saying districts remain dirty. Some are being told to use their personal safety kits. but it's likely they won't get another. What's your response to that?
Well, we've increased the cleaning of all the stations. I visited many of the districts, if not most of them, over the past week. They all look very clean to me. You know, and obviously there may be instances where a thorough cleaning is needed, but to call our stations dirty is not accurate. I've been in many police stations across this nation, and these are well-kept facilities. And we have increased the cleaning schedule to make sure that they remain in that way, and increased the cleaning schedule of our cars, which are truly the office of most police officers. So, you know, I would take issue with that. As far as dispersing crowds, you know, we have many options that are at our disposal, including PAs in the vehicles, including various warnings that can be done remotely, and we'll try to use those. You know, breaking up crowds physically has not been necessary in any of the other major cities that are dealing with this, and I don't think it will be necessary in Chicago. You know, we have seen by and large, and I mean to a huge extent, great cooperation from the public, and I expect that to continue.
Mayor, on parking enforcement, you've said that it's supposed to be limited to public safety. Just anecdotally, there are a lot of parking tickets on cars. I saw a parking ticket this morning, 9th and State. I didn't see a public safety issue.
So what we've said, just to be clear, it's not free parking all over the city. So I think some people thought that what we announced last week meant that they could park anywhere, anytime, and not have to worry about a ticket. Yes, we are focusing our ticketing activities on public safety violations, things that are problematic, parking near a fire hydrant and such. But that doesn't mean that you don't have to pay the meter. You do. While we're not sending people to collection from now until April 30th, we still expect people to abide by the law. This isn't free-for-all. So we want people to not have to worry about some collector knocking on their door, sending them into bankruptcy, but you still do have to pay the meter. Other questions?
Dr. Arwady, you mentioned the number of people who are infected and the deaths in the city of Chicago. Are you seeing that the virus is being spread in the community? Is that really the concern about people gathering along the lakefront, people going outside? Are you seeing that that's actually how it's being spread?
So it's clear internationally here in Chicago, the main way for sure that this virus is spread is through the close contact, and that means households predominantly. My concern is that when people are leaving households and going out and gathering more, you are potentially having more close contact, and then you can be, you know, bringing the virus back into your household. So, you know, if we've been answering a lot of questions about sort of what do I do if I'm sick, and we have guidance about this on the website. But really, the goal is to not have more close contacts with more people than you have to have. And so even if we take that to the going out and exercising example, safest is out by yourself. Next safe, if you're with somebody who's in your household, you're already considered a close contact. But it's not really a time to be meeting up with your running buddy or going and getting together with the group that you would normally do yoga with in the park, you know, especially in this close contact kind of way. It's a time for limiting contact with others. And I hate to say that from a mental health standpoint, from a social standpoint, but right now, for this next period especially, we've just got to do it. We're going to be focusing tomorrow on mental health, actually, in the Facebook Live, and a lot about how we keep mental health up at a time where all of these restrictions are in place. But that's really the priority.
But is it happening? Your 730 confirmed lab cases, were those how many of those were community spread?
So at this point, you know, once we have more than 100 cases, we start saying we're in a phase of spread in the community. That's not a magic switch. It's not like you move from one to not one. But over time, and this is why, as we looked at the data, as you're adding these increasingly strong social distancing orders on, that's because you start to see more and more spread. So I mean, it was just 2 weeks ago maybe that we announced the first case of community spread, and increasingly, you know, as I've been saying, everybody is going to know somebody who has had coronavirus or a friend of a friend, an exposure, because we're seeing it in the community. Early on, we could follow. We did a lot of work following every China from every traveler from China. Lots of work around every contact of any potential case. We're not at a point anymore where you can always know who is at risk. Right? And so this recommendation about really being in as little contact as we're able to is because I can't say right now when someone is diagnosed for sure how they got it. In most cases, as we've seen in, here in Chicago, around the world, it is a close contact in the household. But in terms of where that started and how it came in, a lot of times we don't even necessarily know at this point. And so this isn't an on-off switch, but it's a signal. We put the orders in because it's a signal that increasingly it's here in Chicago.
Thank you, Tom. We're going to take questions from Kate now.
All right, Dr. Arwady, while we still, sorry, Mayor. This question's from Fox 32. I guess along that note, what should people keep in mind as they run trails, go on walks outside? I know you talked about exercising solo. The follow-up question was, can you transmit the virus outside while passing a stranger should one party yield?
Yeah, so again, how this spreads is through the close contact. We've been teaching this from the beginning. It's the close contact within 6 feet, 10 minutes. The chance of a contact in a fleeting way passing each other is not a significant risk. But the issue is that when the lakefront looks like a Saturday in July, even if people think that they're trying to be very conscious, the distance between two people is more than they may be thinking. And as we start to just have people, you can't move, they're together, people are congregating. The worry is not so much that one individual interaction may have that issue, but we just don't want people coming together in ways where even if they're trying to social distance, they're having trouble doing it. One person on the lakeshore is not a problem, but as you start to get more and more people, even when people think they're social distancing, you can't really social distance in a crowd.
And let me just add to that. I was driving along Lakeshore Drive last night. I've looked at the cameras along the lakeshore today, and what we're seeing is packs of people along Lakeshore. It's not ones, it's not twos, it's packs of people. And yeah, you may think in my mind, hey, I'm just going out and I'll only be out. But you're going to a destination point that in ordinary times is one of the greatest assets in our city. But when we have masses of people out there, as I just saw right before I came here to this press conference, it's a problem. We know what happens when we don't social distance. We know what happens when we don't stay inside. The illness rate goes through the roof, the strain on the hospitals is enormous, and the death rate starts to escalate. We don't have to guess that that's what will happen. We know it for a certainty, which is why we're spending this time every single day to say you are safer at home. You must stay at home. Period.
And Mayor, while I have you, I know Superintendent Beck also touched upon this, but so police will be getting involved. Today is just a warning, tomorrow is a citation and a fee, is that correct?
Yeah, what we want to do and why we're spending this time talking about it is to educate people into compliance. Just be smart, be safe, stay at home. But if there are people out there, and unfortunately there are, that are determined to do whatever they want, despite orders. These are not recommendations. This isn't guidance. This is an order that's enforceable by law. We're going to give you an admonition, and if you don't turn right away and head home, then you're going to get a citation. And if worse, yeah, we will take you into custody. I hope that it doesn't come to that. I hope that I don't have to shut down the lakefront and shut down all the parks, but I will if we cannot get compliance. So today's the day to change your mindset, think about how you can exercise in a different way, where you can go where you're not going to congregate in crowds. And if we do that, then we're all going to be fine. We will get through this. But by hook or by crook, I am determined to make sure that we do not suffer the fate that we've seen across the world, which is escalation in the spread of this virus because people simply ignored the warnings that they had been given.
And Mayor, another question from another producer. Have you spoken directly with the president? Are you in direct communication with anyone on his team about Chicago's specific emergency needs? And how has the corona pandemic and social distancing affected Chicago crime numbers?
I have not spoken directly with the president since this began. We've been in contact with people in the White House and in some of the agencies that have been involved in responding to the crisis, but I've not spoken to the president directly, and I don't expect to. Regarding crime, and I'll let Superintendent Beck see this. Look, we can't specifically say that the crime rate is affected by coronavirus, but obviously what we know going back many, many years and looking at data is that when large congregations of people are outside in neighborhoods where gun violence is prevalent, that increases the risk. So as people are staying inside, yes, over this period of time, again, can't directly say cause and effect, but we're seeing a downward trend in shootings and homicides, certainly year over year, but also from what we saw earlier this year. And I don't know, Superintendent, you want to add to that?
So the facts are that Part 1 and Part 2 crime, general crime, has been down all year, and it's still down. It's down 7% today. We have had, and it's no secret, we've had a difficult first 2 months of the year, January and February, with gun violence, homicide and shootings. This month, we have seen that decline. And, you know, I think it's way too soon to ascribe it to any one particular thing, but we have seen a declination. So that is good. You know, we still have a ways to go, but I think we will achieve it.
All right, and we've got one more question from another outlet. Given the long lines of cars at testing sites, what is being done to ensure first responders are being tested? Do they have enough PPEs to keep them safe while they do their jobs?
Well, I'll start and then I'll invite the doctor in. As we've repeatedly said, our first responders are a critical link in this crisis. And we've got to keep them safe. We've got to keep them healthy. We've got to relieve the stress on them, which is why we've engaged with, for example, organizations like Sitter City to make sure that we're providing support for first responders, police, fire, EMT, call takers and dispatchers. They're on the front lines, and we need them to be there to keep pushing forward in this time of great need in our city. And we're doing everything we can to make sure that we give them the training and the equipment they need to be able to rise to this occasion. Dr. Artie can talk more specifics about what we've done in that regard. Doctor?
Yes, I would just say that first, in addition to the volunteer, there is obviously space on the website for donations, and we appreciate people who have been sending in PPE and really making sure we're building those stocks up more. We have stocks that will cover our first responders, our hospitals. As I've said, we are in much better position than a lot of other places are, but we recognize that the supply chains have been disrupted in ways that we have never seen before. And so even the normal supplies that our hospitals are able to get, in some cases they're having trouble getting it. We are making sure that the supplies that we have that have been kept in the best condition, et cetera, will be prioritized for our hospitals and our first responders. But we really appreciate all of the donations and the work and the help to procure a lot of this material and really think about production of it that is happening. That now is the time, Chicago, around the world, you know, et cetera, to be doing that. Regarding the testing, if you look on our website, we have some pretty clear guidance on there about who needs testing at this point. We don't have enough tests to do the big broad testing that we would love to do. Again, that's not really so much because we don't have the coronavirus specific part of the test. It's because with these supply disruptions, the basics of the what's called the media, the things that are not specific to COVID, but that you need to run the test, or even the swabs, have not been in supplies. And so every day we are seeing more testing capability. We're seeing more labs come on. We're seeing the commercial labs really build up, but we're still not at a point where honestly there can be broad testing. I know that there have been a couple of these sites that have been set up for some of the testing with a priority towards first responders. If somebody does not have symptoms, they do not need a test, period. Let me just be be very clear about that. The test will not even work. It detects us, you have to detect a certain amount of virus in the nose or in the back of the throat. And you could, if you don't have symptoms, you could have coronavirus and have a negative test. So nobody who's asymptomatic. And really, the strongest recommendation, again, if people are sick, it's less about testing and more about staying home if they're having a mild illness. We've got a lot on the website about that. I think, the prioritization is important here. We want to make sure we have testing available for our jail if we need it, for our homeless shelters if we need it, for our nursing homes if we need it, and definitely for people who are hospitalized or in the ICU. We have ways to track the trajectory of this virus that don't require everybody to get tested. Where we count things like ICUs or deaths, all those folks are obviously getting testing, so we understand what that's looking like, and we can extrapolate out from there and have a good sense at a public health level. But getting a test does nothing to change the way an individual is treated. If somebody comes in with coronavirus symptoms and they get a test and they're well enough to be home, the instruction is go home and stay home until you're better. If they come in and they get a test, whether it's positive or negative, and they need to be in the hospital, they'll be admitted to the hospital, but there's not a specific treatment, there's not a vaccine, nothing different happens to you on an individual level if you get a test. And really at a public health level still, we have to keep them prioritized for the spaces where it will make big differences in terms of how we move populations. So I think with that, that's plenty.
Okay. Let me just pick up on one point, though, that the doctor did make, because I've heard this. Hey, we need to be mass testing all of our first responders, every police officer, every fireman. As the doctor said, if you were asymptomatic, the test isn't going to give you any comfort because it's going to come back negative and it's meaningless. This is not like some other diseases, and I'll say cancer, where you can run a blood test and you can figure out, even if it's latent, that you have cancer. This isn't what this virus is. The only way that the tests are effective is if you are symptomatic, which means that in order to do everything you can to avoid contracting the virus, you've got to follow the guidance. Cover your mouth when you cough, sneeze, or yawn. Make sure that you're frequently washing your hands. And doing all those other things that require us to keep ourselves safe. If you are sick, and as the doctor said repeatedly, even a little bit, stay at home. So I think we probably ought to go to the questions that have come in.
Our first question from Heather Sharon at the Daily Line. The governor acknowledged that the state budget for 2021 would have to be entirely scrapped because of coronavirus. Have you asked your budget team to start over for 2021?
There's no need for us to start over for our budget, either for 2020 or 2021, because we have baked in assumptions for an economic downturn, in particular for the 2020 budget and in our forecast for the out years. So we are certainly within the parameters that we believed we would be in the event that there was an economic downturn. So I think we're in good shape for now.
Our next question from Fran Spielman at the Sun-Times. With city revenues plummeting and investment returns on city pensions also doing the same, is it time to reconsider the idea of a pension obligation bond?
So, love you, Fran, but the assumption that city revenues are plunging is just patently untrue. As I've said now several times, a couple things. Number one, there's no one revenue stream that is more than 13% of our revenues. And aggregated together, the so-called economically sensitive revenue streams are no more than 25% of the revenues that feed our annual budget. So, one, our revenue streams are not plummeting. We are in good shape. We built this budget based upon an assumption that many had forecast last summer that there would be some kind of economic downturn this year.
Great. Our next question from Greg Pratt at the Tribune. What is the city of Chicago getting from the stimulus bill? How many dollars and what specifically?
Well, There's no stimulus bill yet that I know of. I know something passed out of the Senate in the early morning hours. I think it's in the House and it's under consideration. What I will say is we spent a lot of time over the last few weeks really in conversation with our two senators, Durbin and Duckworth, as well as various members of Congress who touch Chicago to educate them about the specific line items that we thought really needed to be in a stimulus package and making some prioritizations. They heard us. They've been incredibly responsive. So we'll know what the final tally is, but I feel comfortable, given what the needs are in our city, that we're going to get our fair share and that money will be coming to us directly with the flexibility that we need. But we won't know what the final tally is until we see what the House does, and in the event that there's some kind of reconciliation between the House and the Senate. But I'm hopeful that we know that, but I want people to know we've been on the case. I sent a letter, I think a week to 10 days ago, outlining a set of priorities of what we needed for Chicago.
And our last question, Kelly Bauer from Block Club. Any update on the CTA? Has service been cut, or have there been any problems getting drivers?
The CTA continues to be strong. Obviously, we've seen a decline in ridership as people are abiding by the governor's stay-at-home order. But we continue to talk to the CTA every single day. We have no current plans to cut ridership or the offering of services. So we feel like we're as good as we can be under these very difficult circumstances. But again, we made no secret of the fact that there needed to be an influx of resources to support mass transit, both in Chicago and really in the entire region.
Mayor, can you talk about what the city is doing for healthcare workers to help them with child care? Might you be able to open some schools and have them drop off their kids?
Well, that's the particular stress that both healthcare workers and first responders are facing in this time, particularly with the schools being closed. We needed to give them extra support. That's why we were grateful for the partnership of Sitter City, which stood up a website on Sunday, and we've been publicizing it, and I'm happy to have the opportunity to publicize it here today, specifically focused on providing support for healthcare workers and first responders. So if you go to sittercity.com, you'll see a link there to be able to volunteer, and we're really encouraging people who are already pre-screened to be able to take care of children to provide the support for our healthcare workers and our first responders. So thank you all. Appreciate it.
Everybody.
And you have been watching Chicago Mayor Lori Lightfoot and her team updating the COVID-19 situation here in the city. Some of the strongest wording we have heard so far, urging Chicagoans to stay home. The mayor reminding all of us that the stay-at-home order that all of us are under right now is a public health order. It is not a recommendation. The concern right now is with the weather getting nice outside. The mayor says they are seeing way too many people gathering like it is just another day. The mayor stressing this is not just another day. In fact, the next 2 to 3 weeks will be critical for us to bend that curve. As you have been hearing, the interim police superintendent Charlie Beck saying that the educational part of this order is now over, that police will start to issue citations if people do not heed the warning to stay home and not to congregate. Again, some strong wording coming from the city urging Chicagoans continue to stay home and follow social distancing. We will continue to follow all of the latest developments happening today in the city and the state and the country, and bringing you a complete wrap-up coming up on Eyewitness News at 4 p.m. As always, updated information 24/7 on ABC7Chicago.com. We're also standing by for a 2:30 daily briefing from Governor Pritzker, and I'll be coming back on air for you as soon as that happens. For now, I'm Judy Sue in the ABC7 Newsroom. I'll see you soon.